Many nights, I lie awake thinking about a pattern I keep seeing in people over 60. Not something dramatic, not something anyone complains about right away, but something that quietly shows up in their tired eyes, their stiff mornings, and the way they say, "I don't know why I'm still exhausted. I slept all night." What troubles me is that many of them are doing something every single night that gently works against their body without realizing it. As we get older, our bodies don't recover the same way they once did. The spine isn't as forgiving. Joints don't bounce back by morning. Breathing can become more shallow without us noticing. And yet, many people are still sleeping in the same positions they used decades ago, positions that felt harmless then, but now may be adding strain, pain, or even affecting the quality of their sleep. I've noticed that when I ask simple questions, how they sleep, how they wake up, there's often a pause, a quiet moment of realization, because the aches, the morning headaches, the nighttime waking, or that foggy feeling during the day didn't start all at once. They crept in slowly. And for many, the common thread is the position they settle into night after night. What worries me most is that this isn't about rare conditions or complicated diagnoses. It's about habits we never think to question. The way we place our head, the way our back twists, the way our chest rises, or doesn't, while we sleep. These small details can matter much more after 60 than most people are ever told. And that's why I wanted to talk with you today. Because if you're over 60 and waking up sore, unrested, or just not feeling like yourself anymore, this might not be just aging. It might be something happening quietly while you sleep. As we move past 60, sleep becomes less forgiving than it used to be. I often remind people that this isn't a failure of the body. It's a natural shift that deserves a little more care. Inside, subtle changes are happening. The discs between the bones of the spine thin slightly. Joints lose some of their cushioning. Muscles don't relax and reset overnight the way they once did. All of this means the position you hold for 6, 7, or 8 hours can have a much bigger impact than it did years ago. One of the biggest changes is in the spine. Research shared by institutions like the Mayo Clinic shows that as we age, spinal alignment becomes more sensitive to prolonged pressure. When the spine is twisted or unsupported for hours, it can irritate nerves and strain surrounding muscles. That's why many older adults wake up with lower back pain or stiffness that seems to come from nowhere. It often started quietly during the night. Breathing also changes with age, even in people who have never had lung problems. Studies supported by the National Institutes of Health have shown that chest wall flexibility decreases over time. Certain sleeping positions can gently restrict airflow, making breathing shallower and lowering oxygen levels without fully waking you up. You may still sleep, but your body doesn't get the deep, restorative rest it needs to repair itself. Circulation plays a role as well. As blood vessels naturally stiffen with age, prolonged pressure from certain positions can slow blood flow to the arms, legs, or even the brain. That's why some people wake up with numb hands, tingling legs, or a heavy, foggy feeling in the morning. It's not always a serious condition. It's often a positioning issue that can be corrected. What's important to understand is this. Many of the sleep problems people blame on aging are not inevitable. They're mechanical. They're positional. And once you understand why your body reacts differently after 60, you can make small adjustments that create noticeable relief. If this topic matters to you, please like and subscribe so more people your age can find this information. And I'd really like to hear from you. Have you noticed stiffness, pain, or poor sleep when you wake up? Share your experience in the comments below. One of the most common sleeping positions I see in adults over 60 is lying flat on the back with little or no support. And on the surface, it sounds ideal. It feels neutral. It feels balanced. Many people choose it because they believe it's the safest position for the spine. But this is where many people get misled. As we age, the natural curve of the lower back becomes more pronounced, while the muscles that support it grow weaker. When you lie flat on your back without support under your knees, that curve deepens. Over the course of the night, this gently pulls on the lower back muscles and compresses the joints in the spine. You may not feel it while you're asleep, but by morning, the body remembers. That stiffness when you try to get out of bed, the dull ache that lingers for hours, that often starts right here. There's another concern that doesn't get talked about enough, and it has to do with breathing. Research discussed by the National Institutes of Health shows that lying flat on the back can worsen snoring and mild sleep apnea, especially as muscle tone decreases with age. The tongue and soft tissues of the throat relax backward, partially narrowing the airway. Oxygen levels can dip slightly again and again through the night. You may not wake up fully, but your body never quite reaches the deep, restorative stages of sleep it needs. Some people notice this as morning headaches. Others feel unusually tired despite sleeping all night, and many assume this is just part of getting older. But often, it's not age, it's gravity working against an aging airway. Flat back sleeping can also affect circulation. Without gentle elevation or support, pressure builds along the spine and pelvis. Over several hours, this can contribute to lower back tightness and even subtle nerve irritation, which may explain why some people wake up with tingling in their legs or an unsteady feeling when they first stand. I want to be very clear here. Sleeping on your back is not automatically bad, but sleeping flat, unsupported, and unchanged for years after 60 can quietly create problems that show up as pain, fatigue, or restless nights. The good news is that this is not permanent damage. It's a position that can be improved, and later I'll show you exactly how to do that safely. Another position many people over 60 naturally drift into is curling tightly on their side, knees drawn up, shoulders rounded forward, arms tucked close to the chest. It often feels comforting and protective, especially if you've dealt with stress, cold, or pain in the past. But over time, this tightly curled position can place quiet strain on the body that shows up later in the day. When the body is curled for hours, the spine stays bent instead of resting in a neutral position. According to research referenced by Harvard Health, prolonged spinal flexion during sleep can increase stiffness and aggravate age-related joint wear. In older adults, this can lead to sore hips, aching shoulders, and that familiar feeling of needing several minutes just to straighten up in the morning. The hips are especially vulnerable in this position. As we age, the cartilage that cushions the hip joint naturally thins. Sleeping tightly on one side compresses that joint for long periods, which can worsen hip pain and contribute to inflammation. Many seniors tell me they wake up with one hip feeling tender or worn out, even though they didn't injure it during the day. Shoulders can suffer as well. Side sleeping without proper spacing or support places direct pressure on the shoulder underneath. Over time, this can irritate the rotator cuff and surrounding nerves. Research supported by the Mayo Clinic shows that prolonged shoulder compression during sleep is a common contributor to nighttime shoulder pain and arm numbness in older adults. What's tricky about this position is that it feels harmless. You fall asleep quickly, you feel cozy, but the body stays in that curled posture for hours, and by morning, joints and muscles haven't had the chance to fully relax and recover. This doesn't mean side sleeping is wrong. In fact, it can be very healthy when done correctly. The problem is the tight curl. And once you understand that difference, small adjustments can bring noticeable relief without forcing you to change everything about how you sleep. Another sleeping position I gently caution people over 60 about is sleeping on the stomach. Many are surprised by this because it's often a long-standing habit that began in childhood or early adulthood. It can feel grounding. Some people say it helps them fall asleep faster, but after 60, this position can place significant strain on parts of the body that are less resilient than they once were. When you sleep on your stomach, the neck is forced to stay turned to one side for hours at a time. As we age, the joints and discs in the neck lose some of their flexibility. Research discussed by the Cleveland Clinic shows that prolonged neck rotation during sleep can worsen cervical stiffness, nerve irritation, and morning headaches in older adults. That tightness many people feel when they first sit up in the morning often starts with how the neck was held overnight. The lower back also takes a hit in this position. Stomach sleeping tends to exaggerate the natural arch of the spine, increasing pressure on the lower back joints. According to studies supported by the Mayo Clinic, this added strain can aggravate existing back pain and make age-related spinal changes more noticeable. People often describe waking up feeling jammed or sore through the middle of the back, even if they felt fine the night before. Breathing can be affected as well. Lying face down can restrict chest expansion, especially as rib flexibility naturally decreases with age. This may not wake you up, but it can reduce how deeply you breathe through the night. Over time, that shallow breathing can leave you feeling less refreshed in the morning, even after a full night in bed. This is one of those positions that works against the body quietly. There's no sharp pain during the night, no obvious warning sign, just a gradual buildup of stiffness, discomfort, and restless sleep that many people mistake for normal aging. But in reality, it's often positional stress that the body struggles to recover from after 60. And next, I want to talk about a position that doesn't get much attention at all, because it's not one position, but a habit many people fall into without realizing it, and it can interfere with circulation and nerve comfort overnight. The last sleeping habit I often notice in seniors isn't a single position. It's what I call twisted or asymmetrical sleeping. This is when the body drifts into a slightly crooked posture, one shoulder forward, one hip twisted, legs uneven, or arms flung off the bed. Many people don't even realize they do this. It happens naturally during deep sleep, but over time, it can quietly affect circulation, nerves, and overall comfort. When the body is twisted for hours, pressure isn't evenly distributed. Nerves in the arms, legs, and spine can be gently compressed, leading to tingling, numbness, or that heavy, stiff feeling in the morning. Research from the National Institutes of Health notes that prolonged uneven pressure during sleep can worsen joint discomfort in older adults, particularly in the hips and shoulders. Over time, these subtle pressures can compound, leaving mornings uncomfortable or stiff. Circulation can be affected as well. As we age, blood vessels naturally stiffen, making it slightly harder for blood to flow freely through compressed areas. Sleeping asymmetrically can slow circulation to certain limbs, leaving hands or feet cold or tingly when you wake up. Many seniors don't connect these sensations to sleep positions, assuming they are just part of getting older. Twisted sleeping can also contribute to spine misalignment over time. Even small asymmetries during the night can make it harder for the body to fully relax and recover. That means aches and stiffness aren't just morning annoyances, they're signals that the body didn't get the restorative rest it needs. The good news is that these issues are often completely correctable. Small adjustments, proper support, and mindful positioning can relieve pressure, improve circulation, and reduce discomfort. And in the next sections, I'll guide you through 4 sleeping positions that are much safer, more supportive, and far more restful for people over 60. Positions that help your body repair itself while you sleep. One of the most supportive positions for people over 60 is side sleeping, but done correctly with proper support. Unlike the tightly curled fetal position, this version allows the spine to stay neutral, the hips to rest comfortably, and the chest to expand fully with each breath. It's a position that encourages the body to recover, rather than quietly strain itself overnight. When you sleep on your side with a pillow between your knees, you help maintain proper hip alignment. Research supported by Harvard Health shows that this simple adjustment reduces pressure on the hip joints and can relieve stiffness and soreness in the morning. Your knees and pelvis stay in a gentle, natural alignment, which protects the cartilage and soft tissues that can become fragile with age. The shoulders also benefit. Placing a soft pillow or cushion under the upper arm prevents the shoulder underneath from compressing excessively. Over time, this reduces tension in the rotator cuff and minimizes morning arm numbness or discomfort. Many older adults notice that this small change can transform how their shoulders feel upon waking. Breathing improves too. Side sleeping with proper alignment keeps the airways more open compared to lying flat on your back. Studies have shown that it can reduce snoring and improve oxygen flow during sleep, which is particularly important as chest wall flexibility naturally decreases with age. What makes this position especially practical is that it's easy to adapt. A firm yet comfortable mattress, a pillow between the knees, and a gentle support for the upper arm can make side sleeping both cozy and restorative. Many of my patients report waking up with less stiffness, feeling lighter, and more refreshed after a night in this position. In short, side sleeping with thoughtful support gives your body the alignment it needs to rest fully, reduces strain on sensitive joints, and encourages deeper, more restorative sleep. A small adjustment with a big impact for anyone over 60. Another highly supportive position for seniors is sleeping on your back, but with proper support. Back sleeping often gets a bad reputation, but when done thoughtfully, it can actually relieve pressure on the spine and help the body rest more efficiently. The key is adding gentle support under areas that need it most. Placing a pillow under the knees slightly bends them and helps maintain the natural curve of the lower spine. Research from the Mayo Clinic shows that this reduces pressure on the lumbar discs and surrounding muscles, which can prevent the morning stiffness so common in older adults. It's a subtle change that takes just seconds to set up, yet can make a noticeable difference in comfort. Neck support is equally important. Using a pillow that supports the natural curve of the neck keeps the cervical spine aligned. Many older adults experience neck or shoulder tension from sleeping with inadequate support, and correcting this alignment can prevent irritation of nerves and reduce headaches that appear first thing in the morning. Back sleeping also benefits circulation and breathing. With the spine neutral and the chest unrestricted, blood can flow more evenly and oxygen intake improves. This is particularly important for seniors, as shallow breathing at night can worsen fatigue, brain fog, or even mild cardiovascular strain. Proper back support helps the body maintain a calm, restorative state while sleeping. One of the advantages of this position is its simplicity. It doesn't require curling into a specific shape or managing multiple pillows for every limb. Just the right placement under the knees and neck creates alignment that allows your muscles to relax fully. Many patients notice that after a few nights of this setup, they wake up less achy, with a lighter, more refreshed feeling. Back sleeping with support may not feel familiar at first if you're used to other positions, but it's an excellent way to give your body rest. It truly needs after 60, helping joints, muscles, and breathing all work together overnight. Another excellent sleeping option for seniors is sleeping with the upper body slightly elevated. This position may feel different at first if you're used to lying flat, but it comes with several benefits, especially for people over 60. A gentle incline of just a few inches can make breathing easier, reduce heart strain, and even prevent discomfort from acid reflux or mild snoring. Elevating the upper body helps the lungs expand more fully throughout the night. Research supported by the National Institutes of Health shows that even a small incline can improve oxygen flow and reduce shallow breathing in older adults. For those who wake up feeling short of breath or a bit foggy in the morning, this adjustment can make a noticeable difference in how refreshed they feel. This position also helps with heart and circulation health. When the upper body is slightly elevated, blood has less distance to travel from the lower body, which can reduce pressure on the heart and improve overall circulation. For seniors, this can ease nighttime swelling in the legs or ankles, a common concern that often goes unnoticed until morning. Acid reflux is another area where elevation can help. As the esophagus naturally relaxes more with age, stomach acid can more easily travel upward while lying flat. By slightly raising the head and chest, gravity assists digestion and reduces the risk of discomfort or burning sensations overnight. Studies have shown that even modest elevation decreases reflux symptoms without medication. Setting up this position is simple. A wedge pillow, adjustable bed, or even a few firm cushions can create the right incline. The goal is gentle support, not a steep angle that strains the back or neck. Many of my patients report that once they get used to this position, sleep feels lighter, more comfortable, and more restorative. Slightly elevating the upper body is a practical adjustment that helps multiple systems, lungs, heart, digestion, work in harmony while you sleep. It's a small change that can significantly improve sleep quality and comfort after 60. The final sleeping approach I recommend for people over 60 is what I like to call a personalized comfort position. This isn't about a single perfect posture. It's about listening to your body and making small adjustments that help you rest deeply while staying supported. Everyone's joints, muscles, and breathing patterns are slightly different, so what feels ideal for one person might need tweaking for another. The principle is simple: support sensitive areas, avoid prolonged twisting or pressure, and allow the spine to stay as neutral as possible. For some seniors, this means a slight side tilt with a pillow under the knees. For others, it might be back sleeping with gentle elevation of the upper body. Even small changes, like repositioning an arm or slightly adjusting a leg, can reduce strain on joints and improve circulation overnight. Personalized sleeping also encourages awareness. Noticing how your body feels when you wake up, are your hips sore, your shoulders tight, or your back stiff, can guide subtle adjustments that prevent discomfort from becoming chronic. Research has shown that tailoring sleep positions to your body's needs supports spinal health, circulation, and breathing, all of which are critical for restorative sleep after 60. The beauty of this approach is that it respects your comfort and dignity. There's no rigid rule or uncomfortable setup. Instead, it's about creating a space where your body can fully relax and recover. You can experiment slowly, one adjustment at a time, until you find what feels right. Many older adults notice a significant improvement in morning stiffness, energy levels, and even mood simply by paying attention to these small positioning details. Ultimately, the best sleeping position after 60 is the one that works for your unique body. By combining awareness, gentle support, and small adjustments, you can enjoy deeper, more restorative sleep, reduce pain, and wake up feeling refreshed, without forcing yourself into a position that feels unnatural or uncomfortable. Thank you so much for spending this time with me today. I know life gets busy, and choosing to focus on your health, especially something as personal as how you sleep, is an act of care for yourself that truly matters. I hope the information we've explored together gives you a sense of clarity, comfort, and practical steps you can take to rest more fully each night. Remember, your body is still capable of recovery and renewal, even after 60. Small adjustments in how you sleep can make a noticeable difference in your comfort, energy, and overall well-being. You don't need to be perfect, and you don't need to make sweeping changes all at once. Every thoughtful step toward better rest is a step toward a healthier, more peaceful life. I deeply appreciate your effort to stay informed and protect your health. By paying attention to these details, you are giving yourself the gift of restorative sleep and honoring your body's needs. May your nights be more restful, your mornings gentler, and your days brighter. Thank you for trusting me to guide you.